Good day, my name is Ara. So today I will be discussing about acute and chronic diarrhea. Here are the contents. So for the overview of the system, we have colon and small intestine. The small intestine and colon are components of our digestive tract, which processes the foods. The intestine extracts the nutrients from the foods, and what isn't absorbed by the intestines continues along with the digestive tract and is expelled as stools during a bowel movement. Diarrhea can be present due to irregularities in the small intestine or the large intestine. So we need to know how our digestive system works. So digestive system comprises of GI tract, pancreas, liver, and gallbladder. When digestive system is in its normal rhythm, food and fluid pass from the stomach into the small intestine. Food is then broken down and the nutrients are reabsorbed along with most of the fluid. The remaining waste and some water pass into colon, where more water is absorbed, and finally the waste is passed in the form of stools to complete a digestive system function. When the cells in the small intestines or colon are irritated, the relaxed and regular movement of the intestines can become overactive. Essential salts and fluids as well as nutrients from the food that we eat end up being passed through the colon too quickly, with less fluid being reabsorbed or absorbed by the body. The result is loose or watery stools, which is more commonly known as diarrhea. So again, diarrhea is loosely defined as a passage of abnormal liquid or unformed stool in an increased frequency. So for an adult on a typical Western diet, stools weighs greater than 200 grams per deciliter can be considered as diarrhea. So for the quick comparison, acute diarrhea is less than 2 weeks in duration, commonly caused as infectious causes. So for the chronic diarrhea, we have its duration is greater than 4 weeks, and the cause is commonly non-infectious causes. So for the epidemiology, the number of diarrhea cases in the Philippines amounted to approximately 60.6 thousand in 2020, and the number of deaths caused by diarrhea in the Philippines reached roughly to 2.7 thousand in 2020, reflecting a decline from the previous year's total. So the number of deaths caused by such disease peaked in 2009 and approximately 5.5 thousand. So for the pathophysiology of acute diarrhea, it involves three main mechanisms. We have the first one is increased intestinal fluid secretion. Certain microbes such as bacteria or viruses can attach to the intestinal epithelial cells and stimulate the release of various toxin or inflammatory mediators. These substances can lead to increased secretion of fluid in the intestinal lumen, resulting in watery diarrhea. The next one is the decreased fluid absorption. Inflammation or decrease to the intestinal lining can impair the abnormal absorption of fluids from the intestinal lumen. Commonly cause also infection, toxins, or disruption of the abnormal absorptive mechanism. So the last one is the altered intestinal motility. Infections and inflammation in the intestinal tract can disrupt normal rhythmic contraction of the intestine, leading to increased intestinal motility. So for the uh, pathophysiology of chronic diarrhea, it also involves the following mechanisms. So we have impaired absorption. Chronic inflammatory conditions such as Crohn's disease or celiac disease can cause damage to the intestinal lining, leading to reduced absorption of water, nutrients, and electrolytes. So the second one is altered intestinal motility. Its example is IBS that can disrupt the normal rhythmic contraction of the intestines, causing altered motility. So as a result, in rapid transit of stools through the intestine and decreased water absorption. For the increased secretion, certain tumors such as carcinoid tumors or lipinomas can overproduce secretory substances that stimulate fluid secretion into intestinal lumen. The last one is the bile acid malabsorption, dysfunction in the reabsorption of bile acids in the terminal ileum, um, caused by increased levels of bile acids in the colons. So for the quick comparison, for the summary of acute and chronic diarrhea, we need to remember that acute diarrhea is almost caused by a food or waterborne infection. Viruses such as norovirus and rotavirus are the most common infectious causes. Bacterial causes are also common, particularly what we call traveler's diarrhea, and rarely acute diarrhea can be the initial presentation of chronic diarrheas. So for the chronic diarrhea, its common causes includes food intolerance, IBS, side effects of the medication, and the other important causes such as GI malignancy and inflammatory bowel disease. So I also included five high-risk groups in US. So we have the travelers, and I want to highlight this consumers of certain goods, such as uncooked hamburger associated with enterohemorrhagic E. coli, mayonnaise or cream, associated with staph au and salmonella. For fresh or uncooked food, we have listeria. For fried rice, we have bacillus cereus. For eggs, we have salmonella. And the third one is the immunodeficient persons. The fourth one is the daycare attendees and their family members. And the last of the five high-risk group is the institutionalized persons. So I also involved the classification of chronic, includes the classification of chronic diarrhea. We have secretory causes. It is due to the derangement of fluid and electrolyte transport across the enterocolonic mucosa, characterized by watery large volume fecal outputs that are typically painless and persist with fasting. Its examples are medication, bowel secretion, hormones, and congenital defects in iron absorption. The second one is osmoticosis, occurs when ingested, poorly absorbable osmotic active solutes draw enough fluid into the lumen to exceed the reabsorptive capacity of the colon. Its example are osmotic laxatives, carbohydrates malabsorption, wheat or food map intolerance. So for the third one, we have steatorrheal causes. We had the fat malabsorption can lead to greasy, foul smell, difficult to flush diarrhea, also associated with weight loss and nutritional deficiencies due to contaminant malabsorption of amino acid and vitamins. It includes intraluminal maldigestion, mucosal malabsorption, postmucosal lymphatic obstruction. So for the fourth one, we have inflammatory causes. Inflammatory diarrheas are generally accompanied by pain, fever, bleeding, or other manifestations of inflammations. So it involves idiopathic inflammatory bowel disease, primary or secondary forms of immunodeficiency, eosinophilic gastroenteritis. And for the fifth one, we have the dysmotility causes. Rapid transit may accompany many diarrhea or secondary or contributing phenomenon, but primarily this motility is an unusual etiology of true diarrhea. So we have the last one is the factitial causes. Accounts up to 15% of unexplained diarrheas referred to the tertiary care centers. So for the signs and symptoms, these are the common signs and symptoms of diarrhea. Loose or watery stools for 4 weeks or longer, and the stools may be any color. So we have also the bloating and gas, more frequent bowel movements, a sense of urgency to pass stool, abdominal cramps, nausea, burning sensation, fever, and dehydration. So for the diagnostic tests, we have the blood test, stool test, hydrogen test, flexible sigmoidoscopy or colonoscopy, and upper endoscopy. So for the treatment, for acute diarrhea, we have fluid and electrolyte replacement, loperamide, bismuth subsalicylate, antibiotics such as ciprofloxacin for moderate to severely ill patient, metronidazole, empirical treatment for giardiasis, azithromycin or rifaximin. For chronic diarrhea, we have opiate antidiarrheals, um, bile acid binders for bile acid diarrhea, clonidine for diabetes-related diarrhea, eloxadolin for IBS-related diarrhea, antibiotics or antiparasitics for infections, and fiber supplements such as psyllium to add bulk to the poops. So for the patient counseling, it involves we need to remind our patient to drink plenty of water, include broths and juices, maintain healthy lifestyle, avoid caffeine and alcohol, add semi-solid or low fiber foods gradually as your bowel movements return to normal. Don't eat certain foods such as dairy products, fatty foods, or high fiber foods or highly seasoned foods for a few days, and ask about anti-diarrheal medicines to the experts. So the doctors or the physician can advise you to take loperamide, bismuth subsalicylate, that can help can help the patient to reduce the number of bowel movements. So consider also taking probiotics to restore the healthy balance to the intestinal tract. So here are my references, and thank you.